Hi, Sherry.
Hi, Lucy. Here, I'm going to shut my door real quick. Okay. So I'm just going to,
Welcome, everyone, to Medicare 101 Sun River U class. Many of you are familiar with Sun River U, but on the off chance that for any of you this is your first one, Sun River U is an entirely volunteer-run group here in Sun River where we present classes by people who know things to people who would like to learn things. So if you have, after this class, any feedback that you'd like to give us, we would love to receive it. If there are classes you'd like to teach, we'd love to hear about that. If there are classes that you'd like to take that we're not offering, tell us that too. We'd love to know. My name is Lucy Hilburn. I'm on your screen as Sun River U, but I am one of quite a few people behind the scenes who make Sun River U happen, and I'm honored to represent them today. Our presenter is Cherie Martinen, looking very official with her headset. Cherie is the president of Bancorp Insurance in La Pine. She's a fourth generation insurance agent. Her agency handles personal lines and commercial lines and also health insurance lines. So she is very familiar with Medicare, and she has staff members who specialize in helping people who are interested in health insurance in the Medicare demographic. I'm going to be recording today's presentation so that anyone who's interested in going back to hear it again in case they didn't catch something, or anybody who missed it today and wants to see it can catch it afterwards. But I hope that won't inhibit anyone. Cherie welcomes your questions and encourages you to ask your question while she is presenting rather than after she has already moved on to several slides. So feel free to speak right up. And with that, I will turn it over to Cherie. In the upper right corner of your screen, where it says view, if you hover your mouse there, you can put it on speaker view, and then Cherie's presentation, her PowerPoints, will be full size on your screen. It's all yours, Cherie. Thank you so much for coming.
Thanks, Lucy. So I'm happy to be here. Thanks for letting me speak with everyone on the call or on the Zoom. I heard from Lucy that you normally do these in person, but they've kind of been Zooming lately. So I hope that this will work and everyone can get their questions answered. Everyone, I know some people are on video and some people aren't. Is everyone here already on Medicare, or have you just, maybe you have a couple of people that are on Medicare, Katie's on Medicare, and everyone else is just kind of peeking into that realm and thinking about getting on Medicare?
My husband is turning 65, so.
Okay, great. So you guys are all looking at the right things. I'm going to share my screen. Give me a second. Should see a big coffee cup here. Does everyone see it? All right. So I will let you know right off the bat that my coworker actually was wonderful and put this slideshow together for herself, but she had some medical doctor's appointments that went long. So I am using her slideshow, just letting you know from the beginning. And then I also want to just put a disclaimer here saying that we do not work for Medicare. We are an insurance agent who helps individuals select the correct Medicare plan. We do not work for the Center of Medicaid or Medicare. And that information, this is just an educational event. So I can't answer specific questions about a particular plan that you may be interested in. For that kind of detail, you'd have to talk to one of our agents. Let me see if I can get it to go. Yep. So things that we're going to discuss today, how how do you get original Medicare, what is original Medicare and what does it cover, and your options to enhance original Medicare. So original Medicare was established by Lyndon B. Johnson, July 30th, 1965. It gives individuals over the age of 65 or younger people with certain disabilities such as end-stage renal disease, options for health insurance from the federal government. So if you are already collecting Social Security, now this is, a lot of people do start this way. So if you've already started collecting Social Security before age 65, you will automatically be enrolled in Part A and Part B when you turn 65. Your Medicare card will be sent to you about 3 months before your 65th birthday. So for those people who are already on Social Security, you're going to get your card in the mail. If you have questions about that, you can always contact Social Security office, and I've got their contact information in here later. So not yet collecting Social Security, you can go to their website and apply for Social Security. You can also call the Bend office, which I have the 877 number there, or you can call them on the phone. I would say if you can navigate the online version, it's probably the easiest. Second might be a physical appointment. I know that their offices have been kind of open, closed during this period, and it's kind of like the DMV where you take a number. So get there early and be patient. And then the phone is very similar. Be very, very patient. But that's for individuals who are not yet collecting Social Security. All right, this is her slide here. All right, there's a few things to keep in mind with delaying the sign up for Medicare. So you really want to sign up right away if you can, or automatically sign up for Medicare once you turn 65. It's just easier. But if you have insurance through an employer and that employer has 20 or more employees, you can withhold your Part B. So A is free to most individuals, and we'll go over that in a second. B is the one that has a premium attached. And so if you are receiving health insurance through an employer and you love it and you want to keep going with it, you can always tell Social Security that you want to hold off on getting your Part B, continue using the employer program, and then later on, you'll just have to prove that you had that credible coverage to make sure you don't get any sort of penalty. So this is what a Medicare card looks like. It sounds like some of you already have it. Others of you are looking to get it soon. It's going to have your name up at the top. It's going to have a unique number with numbers and letters. And then it's going to show your hospital Part A and medical Part B, and then the dates that those coverages started. So for most people, it's going to be the first day of the month of your 65th birthday. For others, those people who maybe delayed that Part B coverage until they got done reworking, that they kept their employer coverage, that could be a different number or a different date right here on the Part B. I don't know if you guys can see my mouse. Hopefully you can. So what is original Part A, or what are you getting with original Part A? Original Part A, you're going to get for free if you have paid taxes and worked for 10 years in the United States. That's most of us. You get Part A right off the bat. If you have, there is like a late enrollment penalty for Part A if for some reason you don't automatically qualify and get added. You guys, I don't think you need to go too far into this. Most people, it's not an issue. Most of us have worked for 10 years. We've paid our taxes. You get Part A. So what is Part A? It's going to be hospital, skilled nursing, and hospice. All right. There's a little, so Medicare calls something a benefit period for each one of these lines here. So what is a benefit period? A benefit period begins when you receive services and an inpatient in a hospital and will end when you have been out of the hospital and have not received any skilled care in any other facility for 60 days in a row. So this is important to know just so you know what you're paying for deductibles and per day cost with original Part A Medicare. So a good example would be, let's say you went to the hospital in January for a broken wrist, and then you went back into the hospital in April for a broken hip. So that would be a different benefit period since you were not in the hospital from January. You had 60 days had passed, and then you went back into the hospital. All of your deductibles would start over again with the hip. I know it's kind of confusing, but original Medicare, they use the benefit period as when you have to pay each one of these. Is there any questions on this? Seems very quiet. All right, keep going. So skilled nursing, there are a little bit of, they want you to have, sorry, reading her notes. You're on your way to recovery after the broken hip, then comes skilled nursing. So the skilled nursing is normally after you get out of the hospital, you go to a skilled nursing facility. They can help you kind of get back on your feet health-wise before you go home. Sometimes you don't even need to go to skilled nursing and you go directly home. It just kind of depends on what care you need to receive. For the benefits for Part A, and this is on original Medicare, there's no cost to you for the first 20 days, and then it jumps up to $185 per day from 21 to 100. And then after the 101st day in skilled nursing, you pay 100%. So it's not a big deal unless you're there for a long time. So hospice care or end of life care, there's no charge to you, and you may have to make very limited co-payments for prescriptions not covered by coinsurance for respite care. And this is on Part A, original Medicare again. You also get blood with Part A. I know you guys, this is exciting. I can only see Jolene and Lucy, so I can't tell if everyone else is riveted. You get 3 pints and you pay 100% of it. That's kind of your deductible of the blood. And then additional amounts after that is $0. So Medicare Part A, I always say Part A is hospitals. So then you're going into Part B, and Part B is, this is the one that you have to pay for. So most people get Part A after they worked for 10 years and paid their taxes. Part A, free, you got it, good job. Part B is the one that most of the time gets a payment you have to pay per month to have Part B for doctors. And this one right now is $148.50 a month in 2021. Now the federal government regulates the cost of this, and they are the ones who set the cost. So most of the time for this cost, it's a few bucks every year. So next year, it wouldn't surprise me if it was $149 or it was $150. Now this does vary, and I should let you know just about that as well. That is just the kind of standard amount that most people pay for Part B, original Medicare. There are some where it can go up. So if you have a higher, and that she kind of put the income above the 88 individual. So if you have a higher income, or you and your spouse have a higher income, you will pay more than the 148, and they have it tiered. But most, I would say the majority of people pay the 148. So there is a late fee penalty, and I didn't talk about the A very much, but the B actually happens more than you think, and it's on that employer program. So if you have health insurance through your employer, you want to keep it, and then for some reason you just forgot to enroll in Part B after you lost your health insurance with your employer, you can receive a penalty. It is your monthly premium can go up about 10% for each 12-month period that you are not on Part B. This gets big fast, guys. So if you are eligible for Part B, you do not have an employer plan, enroll as soon as you turn 65. I think the majority of you said that you're not 65 yet. So if you can enroll at 65, that's the best case scenario.
I have a question. Is there any way to, so I am that last, well, almost the last scenario. My employer covered my health insurance for 2 years after I retired. It's one of, it's part of the standard benefit. And, but at 70, you have to take Social Security. So I just turned 70. And they told me that I have a penalty because I didn't sign up for Part B. And I said, I don't need it. And they said, it doesn't matter that because I'm no longer employed, I'm covered, but I'm not employed. They said I have the penalty. So do you know, is there anything I can do about that?
You should be able to prove you had credible health insurance because that's what more they're worried about. Yeah, so you just have to prove that you have that employer plan, which covers your hospital, your doctors, and then hopefully the employer plan covered your prescription drugs too.
Everything. I mean, yeah, I was one of those very fortunate people that I've not paid one dime for healthcare.
Yeah.
So, yeah. So
most of the time you just have to prove that and then they're good.
Okay.
There could be a loophole. I'd have to double check.
Yeah, I just wondered. Okay. Thanks.
Yep. And the Part B, it's interesting. Part A, we don't really see a lot of penalties. Part B, we see a few more. And then later on, we'll talk about Part D, which is actually much more common. So Part B annual deductible, this is for original Medicare. So we're doing original Medicare still. There is a deductible and it's $203 for 2021. So before Part B would help kick in, you'd have to pay that $203 first. Once you've been billed the $203 of Medicare approved amount, then your coverage would start for the year. And so the medical deductible is kind of like an auto deductible. You can think about your auto deductible, maybe it's $500. You know, if you got in a full-on fender bender, you're paying the $500 up front, and then the insurance will kick in. Health insurance and Medicare is very similar, but it might not be the full $500 right up front. If you're getting a knee replacement, obviously the $203 is done, right? But if you go in for blood work or say you just go in for a regular doctor visit, you might not hit that $203. You might only spend $150 and then have to go in for a second appointment to finish that $203. They kind of have it more like the bucket where you're adding to it as you go. So A is hospital, B is doctors, doctor visits, lab works, x-ray, and then durable medical equipment, which you guys might think of as walkers, everything from like a CPAP machine and oxygen all the way to foot. Sometimes if you have prescription for the right type of shoe, orthotics and things like that. All right, they've got the deductible in there, and then the remainder of a Medicare approved amount, and I'm going to talk about that. So what's a Medicare approved amount? I get this all the time. A Medicare approved amount is when your doctor and Medicare have an agreement for what they will be billed and how they will pay it. So if Medicare and your doctor says this appointment at the doctor's office costs $100, Medicare will pay 80% of that amount, and then you will be left with the 20% after that. So Medicare would cover $80, you would cover the 20 for Medicare approved amount. Now what it gets tricky is when your doctor says this appointment costs $150 and Medicare says, nope, it's $100. So Medicare pays 80% of the Medicare approved amount, still the $80. You have to pay the 20 up to the Medicare approved amount, and then the additional 50 on top of that, which they call excess or Part B excess. Now, it doesn't happen all the time because most of the time those doctors know what they're getting into when they're taking a Medicare patient, but it can happen. So we always just like to tell people about it. All right, blood on this one too. 3 pints are free, but then after that, you start getting into the deductible and then the percentage. Home health care. This is for when you're receiving home help, such as dressing a wound or injections, and the goal is to treat any illness or injury to help you regain your independence for the home health care. Any medically necessary skilled care services or Medicare supplies are of no charge to you. You still have to pay the deductible first, but once that's met, then you pay the 20%. So for Part B, you're kind of on the hook for that 20% of Medicare approved amount. So what's not covered? You're not covered for any foreign travel on original Medicare. There's no dental, alternative care, long-term or personal care, and there's no eyeglasses or hearing aids. So don't expect that on original Medicare. You're not going to get it. And you can kind of think of the foreign travel as soon as you go to Mexico, are they going to uphold a American, a federal health insurance from America? That's no. So, I mean, yeah, you can kind of get it. So what can you do to enhance Medicare? And this is kind of what a lot of people come to us to talk about. It's that 20%. So you've got original Medicare A and B, and then people come to talk to us about that 20% on B and just any gaps that might happen from A, or those other additional coverages that aren't covered by original Medicare that we just talked about, which is the vision, hearing, dental, foreign coverage. So there's a couple different ways that people can structure these plans or structure how it works for them. We call them Medicare Supplements or a Medigap plan. There's also prescription drug plans and a Medicare Advantage plan, also known as Part C. So you've got Medigap, Part D as in drug, and Part C for Advantage plans. So this is a big question. Which one's best? I don't know, right? So with a Medicare Supplement plan, and I'm going to stick to kind of this half of the screen here, when you go to the doctor, you'd show them your original Medicare, covering that A and B, then your Medicare Supplement, and that's going to cover a lot of things on A and B. And then you have a standalone drug plan. So you'd have 3 cards with the Medicare Supplement. On the other side, a Medicare Advantage plan, it's going to include parts A and B, as well as additional benefits and Part D. So the big difference between these two that I always like to talk about is on the supplement side, or the Medigap plan. These plans are individual companies. So they, all of the money that comes in, they pay it out just like a car or a home policy would. It's an independent company working under the rules of Medicare. A Medicare Advantage company has contracted on this side, they've contracted with the federal government. So every individual who enrolls in their plan, they receive additional funds from the federal government. And that's how they can keep these plans, in some cases, less expensive, but how they can also kind of bundle everything here. They can bundle the A, B, extra benefits, and the D all in one plan.
Sherry, does this mean that on a Medicare Advantage plan, you don't have a Medicare card? You just have the one Advantage card?
You will continue to have your Medicare card, and it's important to keep and to not damage it. I know it's hard because you keep it in your wallet, but you don't have to hand it to your doctor when you go to the doctor's office.
Thank you.
Yeah. All right, so what is a Medicare Supplement? I kind of talked about this a little bit. It's just going to fill in the gaps from original Medicare. So let's see if what we've got for the next one. And Medicare Advantage, we kind of just talked about that too. So one of the things that people ask, so what's the best between the two? A lot of it just depends on your risk. So a Medicare Supplement plans are going to have a higher premium, and it's based off your age. So the older you get, the higher your premium goes. They also take rate increases once a year based on claims. And then, but on the Medicare Supplement side over here on this side, it's also lower risk. There's very little copays. Some plans have very small deductibles, and then you don't see a bill, which is great, right? That's really nice. On the other side, on the Medicare Advantage side, they tend to have lower premiums. So it's less cost each month to you, and they don't base anything on age. But on the other side, you're paying copays, You're paying cost for a hospital stay. You're paying costs for the tests and blood work and all of that kind of stuff. And so you kind of see how on a supplement, you've got higher costs, but you pay less when you go to the doctor. On a Medicare Advantage, you have less cost per month for the plan, but you might be paying more if you use the plan going forward. And again, this is all based on use. You have to use it to have a copay. All right, prescription drug plans. This is kind of the third plan. So I'm just going to actually pop back to this right here. So we did Medicare Supplements. We did Medicare Advantage. Now we're going to Part D, which is drugs. And the Supplement and Advantage, like that's where most people have questions. They're trying to decide how much risk they want to take. How expensive is it going to be for them each month paying the insurance or for the cost of care when they receive it. All right, prescription drugs. Prescription drugs, when Medicare was originally made, we didn't take that many drugs. It wasn't as needed. But in 2006, it was put into law that prescription drug coverage, they didn't make it mandatory, they made it optional, but they made it so that the fee would make you want to get it, right, when you're 65, even if you're not taking any prescription drugs. The idea behind this was prescription drugs started to soar. You might have seen it with your parents, you might have seen it in your own medicine cabinet. Prescription drugs can cost more than a hospital visit in some cases, which is crazy. So the idea for prescription drugs is you want to enroll it at the same time as you do A and B if you can, as well as your Medicare Advantage plan or supplement. It's going to cover your prescriptions. And then there's a whole bunch more. I think she's got more in here. Oh, nope. Hold on, is there more on D? Nope, she didn't have more on D. All right, let's talk a little bit more about D. I want to tell you a little bit more about it. So for prescription drugs, and you might have seen this with your parents' plans, there is normally a little period there where you're just paying co-payments. So you go to the prescription, you go to the pharmacy, you say, I need to refill my blood pressure medications. They say, thanks, $5. Boom, co-payment, $5, you're done. Where it gets tricky is when you get really expensive medications. So you have a medication that's $1,000 a month. So you pay $1,000 to the pharmacist a month. Once you've hit a certain dollar amount, and it's around $3,000, it's between $3,000 and $3,500 each year. Once you've paid that out of pocket for your prescriptions, you hit something called the donut hole or the coverage gap. And you might have seen this again with your parents. This is where the cost of that copayment changes. So instead of the prescription drug company paying, they're paying 80%, you're paying 20%, it flips. You pay 20% of the cost of that drug. You pay 80, they pay 20. It's a big flip because if you've got a drug where your copayment's $1,000, if it's flipping, you're paying $6,000 when you refill that prescription, and it's a shock. Now they do have a stop to that gap or that coverage gap that they have, and I think it's around like $4,700. So once you've paid that much out of pocket, it flips you back over to something called catastrophic, where you only pay 5% of the cost, and the company picks up the other 95%. I know it's kind of confusing. And I don't know if you can see me along with the slides, but it's kind of like a little wave. So you pay, and then you pay a lot, and then you pay very little. And that's just for prescription drugs. It's important to get prescription drug coverage. I can't say this enough. The late enrollment penalty, they penalize you for every month you are not on a plan. So even missing 1 month, you will have that penalty, and that penalty is lifelong. So you can't get rid of it. You will have that penalty for the rest of your life. Even if you do not take a single prescription drug, enroll in Part D when you turn 65. There's plans for as little as $7 a month. Like just enroll in it. Can't say it enough. And you never know when the doctor's going to prescribe you an expensive one. and you don't want the penalty. My grandfather had the penalty. He had like 15 years of penalty. It added so much to his cost when he finally bought it. Don't do it. But you get nothing else from today. Enroll in Part D. All right, so when can you apply for Medicare? You can apply for Medicare, right? So it's 6 months is when your first, they call it guaranteed issue. And this is when you first turn 65. You're like a brand new little Medicare baby. You get 3 months before you turn 65, and then you get 3 months after you turn 65 to enroll in a Medicare supplement. So a total of 6 months. And it's the same thing with a Medicare Advantage. You have the 3 months before you turn 65 and the 3 months after you turn 65, including your birthday month. So I guess it's a little bit more on this one. The idea here being is they want you to enroll in, you get enrolled in A and B, and they want you to be signed up for a supplement or advantage plan and your prescription drug before your 65th birthday. They want you to have coverage on the first day of the first month of your 65th birthday. If you miss it by a little bit, they give you a little bit of grace period. After that, though, then there's certain times a year you can enroll in each. So a Medicare supplement, you can do it any time of the year if you go through medical underwriting. Now, Oregon is special, and for a Medicare supplement, you can also change your plan on your birthday month. There's only like 4 states in the entire United States that have that. So Oregon, we're special, we have the birthday rule. But you can change anytime you want on this one. It's just, you have to go through medical underwriting, and there's a slew of questions on these guys for the Medicare medical underwriting. It's things from diabetes to osteoporosis to heart disease. So it's a wide range. But if you're healthy, it's fine. You can change any time of the year. Medicare Advantage plans, this is the big one that you always hear about year after year, and you get hundreds of advertisements in your mailbox and on the TV, and people call you and you're like, I'm gonna kill you. This is October 15th through December 7th every year. So Medicare Advantage and the prescription drug plans, you can update or change or enroll during October 15th through December 7th every year, and then coverage starts January 1st. So they're a little bit different in how you enroll. Well, they're pretty much the same for how you enroll the first time, but after that, so after you're 65 and you're on a plan, they're a little bit different. Okay, Medicare Advantage plan open enrollment period. Kind of talked about that a little bit. So this is, yeah, all right, open enrollment. This is so tricky. For some reason, Medicare decided to add an open enrollment period for after you've enrolled. So this is only if you want to change your plan. So let's say you enroll in a Medicare Advantage plan during October 15th to December 7th. It starts on January 1st, and you realize, oh my gosh, my doctor's not in it. This is terrible. What am I going to do? You can always switch to a new plan that would include your doctor during the January 1st to 31st period. It's really just for Advantage plans and Part D, though, and it's really specific and kind of tricky, but they have it in there. And then there's also special enrollment periods, and this could be for somebody who, this is actually very common. The very first one is people who recently moved. So if you spend 80% of your time in Arizona, and then you decide, you know what, coming to Sun River full time, I'm making it happen, I'm getting my Oregon driver's license, this is my full-time address. You move to Oregon, you can have an open enrollment period. This is the same thing if you're leaving Oregon, because your plan might not cover all of the states of the United States. A lot of times the plans are very specific to where they cover. If you're losing health coverage from no fault of your own, this sometimes happens if a health insurance or a Medicare plan goes out of business, or if you are on an employer plan, like Jolene, I think you said that you were on your employer plan, you didn't really want to leave it, but they make you leave it after 2 years. Yeah. Yeah. And then retirement or loss of employment is that other one. All right, so there's a lot of options for you guys for the Medigap or Medicare Advantage plans. There's 20 Medicare Advantage plans in Deschutes County, 29 in prescription plans and 12 Medicare Supplement plans. There's so many options. If you have questions, you can call us. And actually, there's one thing, I'm going to go back. I realized that it wasn't on the slide, but I want to talk about it a little bit. So on this one, I want to talk about Medicare Supplements in a little bit more detail. The Medicare Supplements do have some foreign coverage for people who travel abroad, but they don't include any dental, vision, or hearing. They're like purely just for Medicare Part A and Part B. Some of them do have riders that you can attach for additional premium to cover those things. These guys also, Medicare Supplements, don't really have doctor networks. They just say, as long as your doctor takes Medicare, they'll take our plan, we'll pay them. So Medicare Supplements, you don't have to worry about your doctor being in network. You just have to make sure your doctor takes Medicare, which most of them do, especially in this area. We just have so many people on Medicare, they have to take it. Medicare Advantage plans, these ones tend to have a doctor network. So that's when you find when your doctor's not in network, that could be an issue. This one could be an issue if you spend less than half the year in another state, like Alaska or Arizona or California. If you don't have a network of doctors in that area, it could be an issue, and you might be paying higher out of network costs, similar to like a group plan or individual health plan. And the Medicare Advantage plans, they tend to offer additional services such as vision, hearing, and sometimes dental. So they make it a little bit, it's lower premiums a month, but they make it a little bit richer in the fact that they give you additional benefits, but you're paying co-pays on those additional benefits. So she didn't have that in the notes, but I wanted to talk about that. Is there questions about kind of the difference between a supplement and an advantage plan? That's probably my number one confusion for everyone.
I have a question. I was told I'm actually on Medicare already, and I have a Medicare supplement plan. And when I talked to somebody, they said that since I have a supplement plan, I should keep it because once I go to an advantage plan, I can't go back to a supplement plan. Is that true?
So the concept there is medical underwriting. So technically you could go to an advantage plan and then decide it isn't for you and go back to a Medicare supplement plan, but they will ask you to go through medical underwriting. So it's a list of about 25 questions, including any prescriptions you take. And if for some reason something on the medical underwriting flags the company, you won't be able to participate in the plan. So it's not that you can't go back, it's just they make it really difficult to go back.
Because basically I'm healthy and they told me just keep your supplement plan because you really don't want to go on an advantage plan.
Yeah, again, it's hard to bounce back and forth. So a lot of people see the Medicare Advantage plan as a benefit if you're very healthy because the cost is lower. They have plans like in the $30, $40 range, where a Medicare supplement plan that can be in the $115 range. Not saying that all the plans are those costs, and that is just a generalization. And I'm not talking about any one plan. Someone from CMS is listening. But so the Medicare Advantage, normally it's nice for those people who are really healthy because you're paying the lower premiums and you're not paying any copays. But then when you start having medical issues, and we can all expect to start having medical issues as we age, it's just part of it. That's when individuals on a supplement can sometimes benefit. So the supplement is going to pay more without you paying copays. And that's that risk thing again. That's like this whole point of this slide, right? Are you okay with paying, a $300 copay for an ambulance ride and then another $100 or $300 for a hospital stay per night for the first 5 nights? Is that okay with you? Are you comfortable with that? Or do you want to just pay a higher premium a month, and then when you go to the hospital, you pay a deductible and then you pay nothing else after that? A lot of people like the supplements if they don't want to pay the co-pays. If you don't want to constantly keep getting the bill from the provider or from your health insurance saying, okay, like we did our part, now give us another 250, or we need another 1,000 over here or 25 over here. Supplements are really great because you're not going to pay those things. You just don't see the bill. That's a lot of people love them for that. On the other side though, the Medicare Advantage are less expensive. And maybe you don't use it, so you won't see those copays until later on. But yeah, the supplements do make it kind of hard to get back in once you're out. If you're super healthy, I have had 80-year-olds go through Medicare Supplement underwriting, like all the underwriting questions, and they pass. So it's you never know. It's based on your individual self and your health.
And are the costs of the plans based on your income?
No. Well, Medicare Advantage plans on this side, they do work with the state to help with cost sharing for individuals in low income. But neither one of them base their premiums off of income unless you're in certain state programs, then you can participate in Medicare Advantage plan at a discounted rate. And same with prescription drugs. So if you're looking at a prescription drug plan and your income is below poverty level or at a poverty level on their chart, then you would be eligible to receive prescription drugs for free.
Can I ask a clarifying question?
Mm-hmm.
This is Katie. So what was my clarifying question? How embarrassing. It left my mind, so I'm gonna let someone else go. Sorry.
Was it about the cost for based on pay?
That was it. So original Medicare is based on income per your earlier slide.
Original Medicare. So let me actually, I'm gonna.
Where it said over 100, like over 88,000 or something.
Yeah, and I brought Medicare.gov is a very good resource. I hope you guys can see it here. But they do have, they updated their stuff.
I know because my husband wrote an incorrect amount on his application, and they wrote us back and said, no, your premium's actually going to be this. It's not. So I think the original must have a income variance.
So it does for Part B. And let me get to. Part B is based on your income. They have a nice little chart, and now I'm looking for it and I don't see it. Of course, they're making this hard. But yeah, Part B is dependent on your income. And I think I did have that in a previous slide. It's going to be, but most people pay, it's like way up here, hold on. The majority of people pay $148.50. But yes, if you have a higher income, you can pay higher than that. And most people don't even see this premium come out. It just comes out of your Social Security every month, and then you receive what's the remainder in your bank account. So most people don't even see the 148 come out, but you will receive a statement from Social Security at the end of every year, and it shows that cost coming out. And then again, this 148, this is set by the federal government, so it doesn't go up a lot. Sometimes it stays pretty stable. It'll stay at that amount for a few years, and then other times it'll go up normally between like $2 to $5. Like I said, it wouldn't surprise me if this went up to like 149 and then maybe 150, or it would go up to like 154 or something like that. And they're just raising the cost with inflation is kind of the idea.
I have another question. I see these commercials that say that you can get your 148.50 back from the government. And is that based on your income?
I am not 100% sure what they're talking about for that commercial. I'm sorry, Karen. But yeah, it might be based on your income. And again, so if you're looking for assistance with your income, I would refer you to Health and Human Services. There's an office here in La Pine, just over by the, it's like you're going to the Taco Bell. You turn in there and then there's a blue long building in the back of that courtyard, in the back of that road back there. And they will answer all low income subsidy or any sort of Medicare low income questions. They also help you apply. Most of the time though, if you are turning 65, you receive your Medicare card in the mail, and then you go to apply for prescription drug coverage or a Medicare Advantage plan, they'll send you something automatically. You know, it's about 4 or 5 pages. It's not a lot of questions. You can fill it out and then mail it back in, and they'll let you know if you receive any help for that prescription drug or Medicare Part B coverage. And again, it is based on income, but it's through the state. And then it depends on which state you're in, depends on what amount of coverage you would receive. So for Oregon, we're pretty good about helping people in low income, but other states, I think a good example would be Texas. It might be a little harder to get that paid for.
I have another question.
Yeah.
Should Medicare covers does Medicare cover an air ambulance if it's needed?
They cover some transport. This is where it gets tricky. It's emergency transportation, and there is still the deductible and the 80-20 rule. So if a air ambulance costs $40,000, they would pay 80% of it. You would pay the 20 after the deductible of the 203 were done. It's still an extreme amount of money. And I know in our area, there is a lot of talk about the health, all the transportation for emergency medical. So I can go over it a little bit. I would always suggest that if you have the means to have some sort of coverage for the emergency transportation for air and ground, it's a good idea, even with the Medicare Supplement or a Medicare Advantage. Now the supplements, a lot of times will kind of pick up that bill depending on the transportation. And again, this is the emergency transportation. So if it's not an emergency, it might not be covered, which is also tricky. And the Advantage plans have a copay. And I would say the majority of them, the copay is around $300 to $350 is what you're paying for a regular ambulance or air transport on an Advantage plan. But you can also enroll in certain systems, like each air ambulance normally has a membership. Most ground ambulance also has a membership, so you can be a part of those memberships and then pay even less than that for a transport.
Okay, that was my question, is whether I should continue to pay Air Life and whatever the other system is. And it sounds like I should.
Yeah, it's always the question. It gets really tricky when they get into emergency. So they have to say it's an emergency, and then it has to be an emergency even when you get to the hospital. So if an ambulance comes to your house and they go, "Oh my God, you're having a heart attack," and they take you to the air launch center and they check you at their launch center and they say, "Oh gosh, yeah, like they're having a heart attack," and you get you to the hospital and the hospital says that was a severe panic attack. None of that emergency transport was an emergency.
Oh, geez.
I know, ouch.
Okay.
Ouch, that's a big bill, I know. But I would say most of the time, the majority of people are very good about well, the majority of the emergency responders are going to be pretty good about diagnosing an emergency. That's their job. They're supposed to. Most of the time, they're good.
Okay.
So like I know I've got like our phone number. You can email us. If you have questions, you can visit us here. We're still taking in-person appointments. Medicare.gov is a huge resource. I kind of showed you the website earlier. They've got a lot of information on there if you ever have questions. And then there's also something called SHIBA, or Senior Health Insurance Benefits Assistance. These guys are a little bit different than us. They can help you understand Medicare and kind of understand what's covered and not covered, but they're not going to be able to help steer you to a supplement or advantage plan. They will be able to share information with you, but they wouldn't be able to say, based on the information about your health that you've told me, I think this would be a good plan for you, type of thing. But they can give you that information and help you locate it on Medicare.gov or on different websites or different paper facilities and things like that. And then I did mention Health and Human Services, and it's not on here, but like I said, there is a facility in La Pine that you can visit in person, and they are wonderful. And they will answer lots of questions on low income.
Cherie, for those of us who haven't landed in Sun River yet full time, what is the, how long do you have to be an Oregon resident to get a Oregon plan?
Yeah, so you would qualify for that special enrollment period when you decide to move. And they really just want you here for more than 50% of the time. So when you decide you're going to be in Sun River for more than 50% of the time, and you change your address and you get your Oregon driver's license, that's when they want you to make the switch. And then it really also depends on what plan you currently have. So if you're on a Medicare Advantage plan in Arizona, when you make that switch to Oregon, your doctors might not be in network for that plan. You might not have in-network coverage for St. Charles. You want to switch it as soon as possible. So really, it's as soon as you make that decision and you get the documentation showing that you are an Oregon resident for more than 50% of the time, then you can call and make that switch. They just want to make sure if they mail you something, you're going to get it, and that you have a physical address in Oregon.
Okay.
And I'm sure most of you have like PO boxes in Sun River. So they'll ask you for the physical address and then your PO box.
Thank you.
Cherie, you mentioned that supplement plans covered people for foreign travel in some circumstances. Many people in this area travel either domestically to stay in touch with family or internationally when it's safe to do so. Can you talk a little bit about travel and Medicare generally?
Yeah, so in general, all plans, supplement or advantage plans, will cover an emergency when traveling within American territories. So if you're on an advantage plan and you are visiting family in Florida and you have an accident, they're going to cover it if it's an emergency. It's just covered, you're good. The supplements give a little bit more coverage for out of country. They just help pay for medical similar to Medicare coverage out of the country up to a limited amount. Medicare Advantage plans stop at the border. So it's kind of, Medicare is technically a United States government health plan. So once you leave the United States, that those connections aren't there. I know. I always recommend if people are traveling, especially for long periods of time, to get travel insurance. It's really, really inexpensive, and it can be great for minor inconveniences that aren't medical. Travel insurance can be pretty cheap. They can cover all medical emergencies. They can cover transportation for medical, as well as any sort of remains coverage to get you back in the country for any reason. They can also help with things like lost luggage or refilling prescriptions overseas and things like that. And a lot of the companies do offer certain travel benefits. They just have like a helpline assistance and things like that for when you're traveling. But if you're out of the country, I would say for more than like a couple weeks, just look at the travel insurance. It's normally pretty cheap. I know like even when me and my husband went on vacation for a week, we went to the Philippines. It's a really long air trip, but it was pretty cheap when we got there. We bought it because the volcano was erupting at the time. And we said, if for some reason our travel plans had to be canceled due to an eruption of a volcano, we want to make sure we get our money back. So we purposely purchased the travel insurance for that.
Thank you.
Yeah.
Does your company represent all of the plans, or do you just have a specific kind of few plans that you work with?
Yeah, so we do not represent all 29 prescription drug plans. I'll tell you that right off the bat. But we try to stick with the ones that we think are the best coverage and have some of the best pricing. The Medicare Supplement and the Medicare Advantage plans, I think we're actually pretty close. And again, some of that is based off of like their pricing and their willingness to cover people in our area. So sometimes what insurance policies or plans will do, and you might have even seen this in your home and auto, they'll come into a market like Deschutes County and they'll say, we want everyone to move to us. And so they'll be like the price leader and everybody moves to them. And then they say, oh gosh, we're getting a lot of claims, we're full. And they'll raise their prices really, really high. But nobody wants to write with them. So this happens in Medicare too. No surprise, it's still insurance. But there are a few that just are consistently not wanting to write in Deschutes County, and that's okay. We try to make sure we have all the ones that are available, and if we aren't appointed, a lot of times we'll still enroll you in those plans that are best for you, and we'll receive no payment for them. So we, as agents, receive payment not during a meeting with you, but when a plan is sold under our code. So we receive commission for policies sold from the company. So seeing us is free. You don't pay anything to see one of our agents. Most of our Medicare appointments last an hour. And for a couple, we ask for 2 hours because each individual needs their own plan and has their own needs. So that's free to everybody. You don't have to pay us to see or learn about all of the plans that are available. And if we don't have the one that's best for you, we'll still enroll you in it.
And so are we paying an increased fee to the company, the plan, because we come through you, or?
No, no. They factor that into their underwriting. You don't pay any more if you go through an agent versus if you go direct. So if you got something in the mail and you filled it out, you're going to pay the same amount as if you're coming to somebody and getting assistance.
Okay.
They're all good questions. Are there any more? Right, Lucy, I don't know. I think it's right at 5, so people might be saying, all right, everyone, be quiet. I want to go make dinner.
Well, yes, and I think you've given us all a lot to think about. So we're all just digesting all this wonderful information you've given us. Thank you so much, Cherie, for shepherding us through A, B, C, and D today.
I know.
We really appreciate it. It's been just wonderful. And those of you who are, if you think of any questions afterward, you can reach Cherie at Bancorp Insurance in La Pine. And for now, I think I'm going to end the recording of this meeting, and thank you all for coming.
Thank you.
Thank you.
Thank you.
Thank you, Cherie.
Thank